SARS-CoV-2 is given the name SARS-CoV-2 because it is the genetic cousin of SARS-CoV in 2002. Then coming to the treatment part, the treatment it depend upon the severity of diseases, and that is divided. The severity includes mild, moderate and severe. And today I am discussing about the treatment of the mild cases. So, the treatment includes the drugs used in this are first one is azithromycin. The azithromycin it is given, dose is 500 milligram daily in orally, means through mouth, and it is taken 1 hour before taking food or 2 hours after taking food. The side effect include headache, dizziness, gastric upset and vomiting, etc., and diarrhea also. Then the second drug is ivermectin. Ivermectin, it is only taken orally and the dose is 10 to 15 milligram daily, and this ivermectin, it has been found that this ivermectin has a concentration dependent antiviral effect on SARS-CoV-2. It has been identified in the respiratory secretion of COVID patient. This drug act by inhibiting importin, that is a nuclear transport protein which the virus hijack to increase the which the virus hijack to enhance the infection, and besides it, it also interfere the attachment of the spike protein of virus to the human cell membrane. Its side effect. The side effect include the pruritus, head reeling, nausea, abdominal pain, constipation and some ischemic changes. Then the third drug is doxycycline and the dose is 100 milligram BD. It is given either azithromycin or doxycycline. Then it has no interference with food. It can be taken after food. It should be taken after food. Dose 100 milligram BD and the oral absorption is 95 to 100%. But the side effect are dizziness, vomiting. The side effect are dizziness, vomiting and nausea. Stop. Then coming to the third drug, that is doxycycline, and its dose is 100 mg BD daily, and there is no interference with food. It can be taken after food, but the side effect include the nausea and vomiting and giddiness and esophageal. In severe cases, there is esophageal ulceration. Esophageal ulceration means when if the granules present in the capsule release in the esophagus, then there occur ulceration of the esophagus. And then another side effect is photosensitivity. Photosensitivity means that sunburn or skin reaction are found in the exposed part of some individuals, and then distortion of nails are also found in the side effect of doxycycline. Then coming to zinc. Zinc is a component of various nuclear nucleic zinc is a component of nucleoprotein and protein in our body. So, increase in the concentration of zinc in cells, they interfere with the replication of mRNA virus. So, the virus cannot replicate if there is sufficient amount of zinc present in the nucleic acid and protein. So, but the side effect include its dose is in male it is taken 11 milligram per day and in female it is 8 milligram per day and side effect. But if there is increase long term increase or there is long term intake of zinc, then it causes various hematologic as well as neurologic manifestation. The hematologic manifestation include the neutropenia and anemia. There is increase a decrease in hemoglobin concentration as well as neutropenia means cell concentration decrease and neurologic manifestation, and these neurologic manifestations are irreversible means they paresthesia, myelopathy, these things occur. Stop. Vitamin C. Vitamin C is used in COVID-19 as it is used in common cold. It is a immune boosting agent and it also help in restoration of injured tissues and in some studies it has been found that it prevent the clot formation in arteries and vein. Then the dose of vitamin C. First source of vitamin C. Vitamin C is mostly it is found abundant in tomato, in fruits, in green chilies, etc. and also lemon. Lemon is the richest source. And then side effect of vitamin C. Megadose, if it is taken, megadose of vitamin C is taken for a long period, then it causes rebound scurvy. What is rebound scurvy? Now, because long term intake of vitamin C causes enhance its own metabolism in the body and so also tissue acclimatization. So, there is rebound scurvy. And second side effect is it also causes calciuria in the urine and that help in stone formation. And the third side effect is high dose is if it is taken along with iron, then it is cytotoxic to the body. Then the dose it is 2 to 6 gram per day in human in both male and female. Then vitamin D. Vitamin D, there is vitamin D is used in COVID-19, but there is no conclusive evidence regarding the usefulness of vitamin D in COVID-19. But it has been found that those having deficiency of vitamin D in their body has a higher risk of COVID-19 infection. Then what are the source of vitamin D? The source of vitamin D are liver, then egg and fish. These are the source of vitamin D. But it has been found, but long term chronic use of liquid paraffin interfere with the absorption of vitamin D in body. So, it is an important point. The chronic use of liquid paraffin interfere with the absorption of vitamin D in our body. Then coming to the side effect. Long term and megadose of vitamin D. Long term use of vitamin D causes or overdose of vitamin D for a long period develop the toxic symptoms such as hypotonia, anorexia, irritability, polydipsia, constipation and pallor. Calciuria also occur and it can damage the kidney. So, this is all about the mild treatment in mild cases of COVID-19. Thank you.